In the spring of 1775, a Welsh physician named William Withering watched a woman recover from heart failure using a tea her family had brewed for generations from dried foxglove leaves. He spent the next 10 years documenting 163 cases, measuring doses, and tracking outcomes before publishing the most important work on heart medicine of the 18th century. The plant became the source of digoxin, still prescribed today to over 1 million Americans with heart failure. Number 7 on this list was applied to burns by frontier families 2 centuries before a clinical trial confirmed why it worked. And number 3 involves a compound that treats cancer in 17 different tumor types, developed entirely from the bark of a tree that Pacific Northwest folk healers were already using long before any scientist took notes. These weren't guesses. They were observations passed down through generations until someone with a laboratory finally caught up. Before we begin, subscribe to this channel because the remedies your great-grandmother reached for without thinking are the ones modern medicine spent 100 years trying to explain. Let's count them down. Number 20, the pantry ingredient that replaced surgical gauze in 2 world wars. Honey has been applied to wounds in every recorded human civilization. Folk healers across America packed it into wounds through the 1800s when bandages weren't available. What they didn't know was why it worked. The answer came in the late 20th century when researchers isolated hydrogen peroxide production in honey and identified the antibacterial compound methylglyoxal in high concentration in Manuka honey from New Zealand. In 2007, the FDA approved a commercial honey-based wound dressing called MediHoney for burns, diabetic ulcers, and post-surgical wounds. Field medics in World War I used raw honey on trench wounds when supplies ran low. The soldiers who recovered weren't beneficiaries of folk wisdom. They were beneficiaries of a compound they had no name for yet. Number 19. The tree bark headache cure that became the best-selling drug on earth. Willow bark tea was prescribed for fever and pain by Greek physicians before the Roman Empire existed. Native American healers across dozens of tribes used it for joint pain and fever throughout the 1700s and 1800s, and frontier families brewed it as a tea when aspirin wasn't yet a word anyone knew. The active compound, salicin, converts to salicylic acid in the body. In 1897, a chemist at Bayer named Felix Hoffmann modified salicylic acid into acetyl salicylic acid, a gentler version that didn't destroy the stomach lining, and named it aspirin. The drug became the most widely used pharmaceutical in human history. The original discovery was sitting in the bark of a tree that folk healers had been recommending for roughly 2,500 years. Number 18. The kitchen staple your great-grandmother rubbed on wounds that modern surgeons still study. Garlic has been used medicinally in virtually every culture that grew it. Civil War medics reportedly applied garlic juice to bandages to prevent gangrene in field hospitals. The reason it works was identified in 1944 when a chemist named Chester Cavalito isolated allicin, the sulfur compound released when garlic is crushed. Allicin is a potent antimicrobial agent effective against a range of bacteria, including strains that have developed resistance to some modern antibiotics. A 2011 study published in the Journal of Antimicrobial Chemotherapy found allicin-based compounds effective against methicillin-resistant Staphylococcus aureus, or MRSA. Your great-grandmother didn't know about MRSA. She knew garlic kept wounds from going bad. She was right, for reasons that took medicine another century to explain. Number 17. The root that stopped sailors from vomiting before the Navy figured out why. Ginger root was used for nausea and motion sickness throughout the 1800s by ship crews, frontier travelers, and pregnant women. Midwives prescribed dried ginger tea for morning sickness. The compound responsible, 6-gingerol, was identified in the 20th century and found to interact with serotonin receptors in the gut, slowing the contractions that cause nausea. A 1982 clinical trial published in The Lancet compared ginger to Dramamine for motion sickness and found ginger performed significantly better. Subsequent trials confirmed its effectiveness for chemotherapy-induced nausea and morning sickness. The American College of Obstetricians and Gynecologists now lists ginger as an appropriate first-line treatment for nausea in pregnancy. The sailor who candied his ginger in 1840 didn't need a randomized trial. His stomach told him. Number 16. The berry your grandmother boiled into syrup for winter sickness that turned out to have its own viral disruption compounds. Elderberry syrups and teas were a standard home remedy for cold and flu in American households throughout the 1800s. Farm families grew elderberry bushes specifically for this purpose. A 2016 randomized study published in Nutrients found elderberry supplementation reduced the duration of colds in air travelers by about 2 days compared to placebo. Researchers identified flavonoids in elderberries, particularly quercetin and rutin, that appear to interfere with viral replication and stimulate cytokine production. The evidence isn't definitive, and researchers note that the concentration of active compounds varies significantly by product. But the mechanism your grandmother was relying on, immune modulation through naturally occurring flavonoids, turns out to have a biological basis that folk use alone could not have predicted. Number 15. The grain every 1800s mother kept in her kitchen that your dermatologist might recommend today. Colloidal oatmeal has been used for inflamed and itchy skin in American folk medicine for over 200 years. Frontier mothers bathed children with eczema in oatmeal water made by tying rolled oats in cloth and running bath water through it. Researchers in the late 20th century identified the compounds responsible. Avenanthramides, a class of polyphenols found almost exclusively in oats, with confirmed anti-inflammatory and antihistamine properties. The FDA recognized colloidal oatmeal as a safe and effective over-the-counter skin protectant in 1990. Today, it's an active ingredient in dermatologist-recommended products from Aveeno, CeraVe, and Gold Bond. The frontier mother who wrapped her child's arms in wet oats didn't know the word avenantramide. She knew the rash went down by morning. Here's what nobody tells you when they teach pharmacology. Modern drug development presents itself as a story of science beginning from scratch, identifying mechanisms, synthesizing compounds, and running trials. The actual story is messier. A large portion of the most important drugs in your medicine cabinet trace their origin to a plant or preparation that folk healers were using decades or centuries before any laboratory existed to explain why. The question the textbooks skip is how those healers knew. The answer is that they watched. They recorded outcomes across generations. They passed down what worked and let what didn't disappear. They were doing empirical medicine without the equipment to call it that. Every item on the rest of this list is a case where folk practice got there first and science arrived later to confirm it. Number 14. The spice rack staple that wound up in over 40 clinical trials for inflammation. Turmeric arrived in American folk medicine through immigrant communities in the 1800s and was used for joint pain, digestive complaints, and wound care. The compound responsible for most of its biological activity, curcumin, was first isolated in 1815 but wasn't seriously studied for decades. Research has since confirmed anti-inflammatory and antioxidant properties, with mechanisms that include inhibition of NF-κB, a protein complex that controls inflammatory gene transcription. The challenge is bioavailability. Research published in Planta Medica in 1998 showed that combining curcumin with piperine, the active compound in black pepper, increases absorption by 2,000%. Traditional Indian medicine combined turmeric and black pepper in recipes long before that study was published. Number 13. The juice your great-grandmother drank for urinary infections that scientists are still debating. Cranberry juice as a remedy for urinary tract infections appears throughout American domestic medicine from at least the mid-1800s. Research from Rutgers University in the early 2000s found that proanthocyanidins in cranberries prevent E. coli from adhering to the walls of the urinary tract. A 2017 Cochrane review of 24 studies found cranberry products moderately effective at reducing UTI recurrence in women. Cranberry doesn't cure an active infection. It may prevent bacteria from establishing one. The folk remedy was right about the target. It was wrong about exactly what it was doing to hit it. The distinction is small enough that generations of women who drank cranberry juice were still getting a real benefit. Number 12. The oil your grandmother rubbed on her forehead for headaches that outperformed acetaminophen in a clinical trial. Peppermint oil has been used for headache relief in American folk medicine throughout the 1800s and early 1900s. A 1996 study published in Cephalalgia applied 10% peppermint oil in ethanol to the foreheads of 32 patients and found it as effective as 1,000 milligrams of acetaminophen at reducing tension headache pain within 15 minutes. A follow-up study in 2010 confirmed the effect relates to skin cooling via activation of cold-sensitive receptors, which disrupts pain signal processing in the trigeminal nerve. That mechanism differs from how oral pain relievers work, which may be why it works in people who don't respond well to standard options. Peppermint oil is now listed in European headache treatment guidelines as a first-line option for tension headaches. Your grandmother was not guessing. Number 11. The root Victorian doctors scoffed at that eventually showed up in sleep research. Valerian root was a common folk remedy for anxiety and sleeplessness in American households throughout the 1800s, brewed as a tea or taken as a tincture before bed. A 2006 review in the American Journal of Medicine evaluated 16 randomized controlled trials and found generally positive evidence for valerian improving sleep quality without producing side effects. Researchers have since identified valerianic acid and isovaleric acid as compounds that interact with GABA receptors in the brain, the same receptors targeted by prescription sleep medications like benzodiazepines. The interaction is gentler and doesn't suppress REM sleep the way pharmaceutical options often do. The folk healer who recommended valerian for nervous insomnia was operating on a mechanism she had no language for, but she'd been watching outcomes long enough to trust it. Number 10. The tea your great-grandmother brewed for anxiety that interacts with the same brain receptors as Valium. Chamomile tea has been a household staple for calming nerves in American homes since the colonial period. Mothers gave it to colicky infants. Adults drank it before bed or during stressful stretches. Researchers investigating chamomile in the late 20th century identified apigenin, a flavonoid that binds to benzodiazepine receptors in the brain, the same receptor sites activated by drugs like Valium and Xanax. A 2009 clinical trial published in the Journal of Clinical Psychopharmacology found that chamomile extract significantly reduced generalized anxiety disorder symptoms compared to placebo over 8 weeks. The compound your great-grandmother was delivering every time she put a tea bag in hot water was pharmacologically active in a way nobody understood until the receptor had been identified. Number 9. The plant a country doctor knew worked for sadness long before clinical trials ranked it alongside antidepressants. St. John's wort has been used in American folk medicine for depression and nerve pain since the colonial period. Country doctors in the 1800s recommended it, and farm families grew and dried the flowers for winter. A 1996 meta-analysis in the British Medical Journal reviewed 23 randomized trials and concluded St. John's wort was significantly more effective than placebo and similarly effective to standard antidepressants for mild to moderate depression with fewer reported side effects. A 2008 Cochrane review of 29 trials confirmed the finding. The active compounds include hypericin and hyperforin, which influence serotonin, dopamine, and norepinephrine reuptake. It isn't appropriate for severe depression and interacts with certain medications. But for mild cases, the country doctor's recommendation wasn't folk superstition, it was early pharmacology. Step back from the individual remedies and look at what this list is actually telling you. In every case, a preparation ordinary people used for generations turned out to have a specific biochemical mechanism. The honey had the hydrogen peroxide, the willow bark had the salicin, the ginger had the 6-gingerol, the chamomile had the apigenin. The folk healers didn't know the names of those compounds. They didn't need to, because they had something clinical trials don't always have: multi-generational outcome data. A remedy that didn't work got abandoned. A remedy that did get passed down. That process ran for hundreds of years before the first randomized trial was ever designed. The scientific method didn't arrive to replace that knowledge. In most cases, it arrived to explain it. What it found, almost without exception, was that the people using these remedies were more right than wrong. Number 8. The cactus gel frontier families used on burns that would eventually require a pharmaceutical label. Aloe vera was grown in American home gardens throughout the 1800s, specifically for its burn-soothing properties. The standard practice was to break a leaf and apply the clear gel to burns and skin irritations. Researchers isolated active compounds including osmannin, a polysaccharide that stimulates immune response and aids tissue repair, and aloe, which has confirmed anti-inflammatory effects. A 1995 study in the Journal of Ethnopharmacology found aloe vera gel reduced healing time for minor burns compared to standard gauze. A 2009 systematic review in the journal Burns confirmed aloe vera outperformed petroleum jelly dressings in reducing burn healing time. The FDA has approved it as an over-the-counter cosmetic ingredient. The farm wife who kept her aloe plant on the kitchen windowsill wasn't practicing folk medicine loosely. She was running the most reliable first aid kit in the room. Number 7. The berry tea 19th century mothers used for winter sickness that turned out to have real viral disruption properties. Echinacea was one of the most widely used medicinal plants among Native American tribes across the Great Plains. Settlers adopted it by the late 1800s, and it became one of the most prescribed plants in American eclectic medicine through the early 1900s. A 2015 meta-analysis published in Evidence-Based Complementary and Alternative Medicine reviewed 24 studies and found echinacea preparations reduced the incidence of the common cold by about 35% and shortened cold duration by an average of 1.4 days. The mechanism appears to involve stimulation of macrophage activity and increased interferon production. Not all commercial echinacea products contain the same species or concentration. The 19th century healer working with fresh-pressed echinacea root was likely using a more potent preparation than most modern supplements on store shelves. Number 6. The oil every American grandmother kept for cuts that hospitals are now studying for resistant organisms. Tea tree oil arrived in American folk medicine in the early 20th century for skin infections, nail fungus, and wound care. A 1994 study in the Journal of Antimicrobial Chemotherapy found it effective against a broad spectrum of bacteria and fungi, including Candida albicans. A 2004 clinical trial found it equivalent to the prescription antifungal clotrimazole for treating nail fungus over 6 months. Tea tree oil's active compound, terpenin-4-ol, disrupts bacterial cell membranes through a mechanism that bacteria haven't demonstrated the ability to develop resistance to in the same way they resist antibiotics. Researchers studying resistant organisms are now taking that seriously. The grandmother with the small brown bottle knew something the antibiotic field is still working out. Number 5. The root that 1800s herbalists used for stomach ulcers that eventually became a prescription drug in 2 countries. Licorice root has been used in American and European folk medicine for stomach problems and inflammation for centuries. Frontier healers prescribed it for gastric pain and ulcers. The compound glycyrrhizic acid has confirmed anti-inflammatory and antiviral properties. A modified version, carboxylone sodium, was developed in the 1960s and approved as a prescription drug for gastric ulcers in the United Kingdom. Studies found it stimulated mucus production in the stomach lining, protecting tissue from acid erosion. It was one of the first pharmacological ulcer treatments developed before researchers discovered that most ulcers are caused by H. pylori bacteria. The folk healer who recommended licorice root for stomach pain in 1850 didn't know about gastric mucosa. She knew it worked on something specific in the stomach, and she was right. Number 4. The autumn wildflower used for gout for 2,000 years that your rheumatologist still prescribes today. Autumn crocus, or colchicum autumnale, was used for joint pain and gout in Greek and Byzantine medicine from at least the 6th century. American herbalists in the 1800s used it for inflammatory joint conditions. Colchicine, the alkaloid extracted from it, was first isolated in 1820 and went on to become the standard pharmaceutical treatment for acute gout attacks. The mechanism involves disruption of microtubule formation, which prevents the inflammatory cascade triggered by uric acid crystals in the joints. Colchicine is still on the FDA-approved drug list, reapproved in its modern form in 2009 under the brand name Colchicine. It's one of the oldest continuously used drugs in Western medicine, and it started as an autumn wildflower that folk healers noticed made inflamed joints hurt less. Here's what should sit with you after hearing everything on this list. Every remedy followed the same pattern. It existed in folk practice. Medicine dismissed or ignored it. A researcher eventually looked at it. A mechanism was found, a drug was developed, or the remedy was validated. That sequence repeated not once or twice, but across nearly every major pharmaceutical class developed in the last century. It means the remedies your family trusted had real reasons behind them. And it means every folk remedy that hasn't been studied yet is an untested hypothesis waiting for someone to run the trial. The gap between what folk medicine knew and what pharmacology has confirmed isn't hundreds of years. In most of the important cases, it's a few decades of funding. The next 3 items on this list are the ones that should make you think hardest, because they aren't small remedies for headaches and nausea. They're treatments for heart failure and cancer. Number 3. The garden flower that kills you at the wrong dose and saves your life at the right one. Foxglove, or Digitalis purpurea, was used in English and American folk medicine for heart conditions and dropsy, the old name for fluid retention caused by heart failure, long before anyone understood why. The plant is toxic at high doses. In skilled hands, usually women herbalists who had watched others use it before them, it was prepared carefully. William Withering began documenting its clinical use in 1775 after encountering a patient treated by a family herbalist in Shropshire. His 1785 publication, An Account of the Foxglove, reported 163 cases of successful use with detailed dose observations. The active compound, digitalis glycoside, was later isolated and refined into digoxin, which strengthens heart muscle contractions and slows heart rate. Digoxin is still prescribed today for atrial fibrillation and congestive heart failure. The folk healer who understood that a specific dose of foxglove could make a failing heart pump stronger was making a clinical observation that cardiology didn't catch up with for another century. She had no trial data, she had generations of watched outcomes, and she used them correctly. Number 2. The bark of a Pacific Northwest tree that folk healers used and that turned out to contain one of the most important cancer drugs ever developed. Pacific yew trees, or Taxus brevifolia, grow throughout the Pacific Northwest and were used in the traditional medicine of several Northwest Native American groups for a range of conditions. In 1962, the National Cancer Institute began a broad survey of plants for potential anti-tumor compounds. Researchers collected Pacific yew bark without knowing what they'd find. In 1967, Chemists Arthur Barclay and Monroe Wall isolated paclitaxel from the bark. The compound, later marketed as Taxol, works by binding to tubulin in cancer cells and preventing the cell division needed for tumor growth. It became a first-line treatment for ovarian, breast, lung, and other cancers. The FDA approved it in 1992. By the mid-1990s, Taxol was among the best-selling cancer drugs on Earth. The tree had been growing in Pacific Northwest forests for thousands of years. The folk practitioners who used it knew something was in the bark worth paying attention to. What was in it was a compound treating an estimated 1 million cancer patients a year. Number 1. The pattern itself, and what your grandmother's medicine chest was actually doing all along. Pull back from every item on this list and the picture becomes clear. Honey, willow bark, garlic, ginger, elderberry, oatmeal, turmeric, cranberry, peppermint, valerian, chamomile, St. John's wort, aloe, echinacea, tea tree, licorice, colchicine, digitalis, paclitaxel. Every single one was used by folk healers, frontier families, and ordinary American households before the mechanism was identified. And in every single case, when researchers looked closely enough, they found a real compound doing a real thing to a real biological target. That is not coincidence. That is centuries of observational data compressed into a remedy. The mothers and grandmothers who maintained these preparations weren't credulous. They were practicing evidence-based medicine with the only method available to them, watching what happened when people took something and passing down what worked. Modern pharmacology didn't replace that tradition, it confirmed it. The lesson isn't that folk medicine is always right. It isn't. The lesson is that the distance between what your grandmother knew and what your doctor knows is shorter than either of them was ever told. That gap has been closing for 250 years, one documented mechanism at a time, and in most of the important cases, it's already closed. One thing worth doing this week. Pick a remedy you keep in your house, something your family has used for a generation that you've never questioned, and look up whether it's been through clinical trials. You might be surprised how much research is sitting behind the thing your grandmother called just something that helps. If this changed how you think about what the people before you already figured out, share it with someone who writes off folk medicine as superstition. There's a generation alive right now that watched their mothers keep aloe on the windowsill and chamomile in the cupboard. They deserve to know those choices were right all along.